Hi, my name is Dr. Todd Cunningham. I'm a school and clinical child psychologist in Ontario and one of the psychologists at the Bright Light Psychology Clinic.
Hi, I'm Bacher, and I'm an educational consultant at Bright Light Psychology Clinic. Today, we wanted to talk a little bit about one of the services that we provide, which is therapy for children. So, Dr. Cunningham, what does therapy for children actually look like?
So, therapy can take on different formats, but typically it's in a one-to-one situation where the psychologist is working with the student or the child, and we usually use a kind of a procedure. This is not just simply sitting down and kind of just talking like you would do with another adult, but in therapy we have kind of a manual that we're following in terms of guiding us through different steps. So it's a really guided conversation that we're having with the child, as well as creating kind of situations, work activities to be able to help them up. So let's take first example, if a child is feeling fearful about going outside. So what we would do initially is we kind of hear about those challenges the student is having. We'd actually kind of create a ladder where we say, okay, at the end we want to be able to go outside, and then we can break down all the kind of the small steps to be able to do that. And then we'd start to teach the child some coping strategies. So in therapy, typically there's also homework that the child's going to have to do in between sessions, where they're going home to practice some of their coping strategies, maybe monitoring their thoughts that they're having, or working at kind of an exposure, working at one of the fears on their ladder to be able to do that. There might be also a parent component. Sometimes with our younger children, we bring the parents in for the last kind of 10-15 minutes to be able to let them to go over the work that has been done, so the parents can help support their child in it. And often we'll also create a reward system for younger children. You know, if you're able to get your homework done, if you practice your skills in between, you'll be able to earn some rewards along the way so that you're able to do it. But over time, we will kind of continue to monitor the progress of that individual as they move closer and closer to that goal that we have. So if I have a child who's fearful of going outside, we'll start off by just thinking about going outside, by talking about going outside, by maybe going outside with a parent to the point where they're able to then go outside by themselves. And once we get to that goal, then we celebrate with the party that we've been able to get there. This kind of approach is called the cognitive behavioral therapy approach, or CBT, that really links the idea of thoughts, feelings, and behaviors together so that we can support them. And it's one of the most well-researched kind of approaches in the area of therapy.
Thank you so much. I think parents will really appreciate knowing a little bit more about what seeking out therapy for their child might